With the COVID-19 pandemic, routine clinic visits became viewed as potentially dangerous activities, since people think it is more likely to encounter people who are sick and possibly have COVID in hospitals and clinics. And so doctor visits became reserved for conditions that could not wait or were already severe. Our specialty is rather unique in the sense that most of our patients have a chronic condition that they know requires regular follow-up. So it is important that they know and feel that the institution has taken clear steps to try to reduce the risk of transmission, delineating separate areas for COVID and non-COVID patients, having donning and doffing areas, ensuring that temperature checks and social distancing and masking policies and hand hygiene are constantly and consistently implemented and enforced on site. And also, added details like being mindful of air change per hour, having wave-activated alcohol dispensers, and even wave-activated parking ticket dispensers in place. Being mindful of such small details helps to communicate to patients that their safety is top of mind for that institution. And I believe this helps predispose them to be more receptive to patient education.
Ntti has stepped up in heroic ways to meet the challenges of COVID-19. This pandemic has cultivated innovative ways to continue our care for our patients while trying to minimize the risk for other patients as well as hospital staff to contract the disease. We ramped up our testing efforts. We modified our triage. We started building tents, including hemodialysis and peritoneal dialysis tents, creating a makeshift intensive care unit, and developing COVID-19 isolation tents. After which, our institution also altered the ward setup and organized a cohorting system, separating those with and without pneumonia and those with and without COVID-19, even installing negative pressures on wards. Inside the hospital, we also had team effort interdepartmentally. Surgery, radio, patho, and other specialties helped in triaging and ambulance conduction. We dynamically adjusted our management with the crisis, but made sure we do not compromise the medical care to our patients. Since many were lost to follow up due to the lockdown, we opened new avenues to accommodate. While we did not completely remove face-to-face outpatient consults for those who were not able to adapt, like those from provinces with little access to the internet, we developed online platforms. So we conducted telemedicine to continue catering for our OPD patients, especially to those who have fear of going out. Though this may limit our objective findings of physical examination, this, however, helped many of our patients feel safer in the midst of the pandemic. We also promoted kidney health awareness and tried to be creative to attract and sustain attention while disseminating information. We used Facebook, Instagram, and even made a YouTube channel, Batoba Topic, taking into consideration that content must be clear and accurate with the data because we don't know how audience will take these and apply it in their lives.
For OPD, telemedicine among our indigent patients in particular was a challenge. These are our patients who don't have cell phones or laptops, a steady internet connection, or even Viber to be able to continue communication with us. We had to be proactive in giving care to these patients. So with the help of the hospital administration, we were able to devise a simple OPD system to call patients via telephone for checkup with no video call or social media platforms whatsoever. It was difficult at first, but it had to be done. On most days, we now look like a call center seated on our desks calling 8 to 10 patients a day with our headsets, but we've learned that to be able to give the care that these patients deserve, we need to invest in time to explain disease and prognosis to our patients despite the barriers that we are faced with. There was also a time that we needed to reach out to our colleagues in other hospitals to transfer patients, recommend patients for biopsy, or even continue dialysis care. What we normally could do alone, we now had to find ways to help our patients and each other. What was nice about this was the bayanihan spirit that other hospitals extended during the time of this pandemic. We have been able to transfer some patients for biopsy with the help of our consultants and also our co-fellows, as well as endorse some patients for continuity of care. Moving forward, perhaps what we may need to focus on now as the pandemic continues is to find better ways to spread kidney disease awareness and education among our indigent patients on media platforms that they use.
At present, I regularly hold face-to-face consultations in my private clinic, but of course following the recommended protocols. However, for my patients with travel restrictions, I have engaged them to teleconsultations to ensure that patient care is not disrupted. Our hospital has also set up social media account and a page wherein our patients can have access to hospital announcements, health education videos, and articles. This page will also enable our patients to schedule their appointments for face-to-face consultations and remote consultations as well.
We really don't know when this pandemic is going to end. And so we have to adapt. We have to virtualize. I think social media is a great platform to push an increased awareness for kidney diseases. It's free, it's accessible, almost everyone knows how to use it, and you can reach a huge number of people in the shortest possible time. And I think that even if this pandemic ends, social media and the internet is here to stay and it will keep on evolving. So, this is a great endeavor to invest in.